So far, so good. We are here to count our blessings and then keep the templates of our strides. I became part of Thyroid Ghana Foundation in the year 2018, and then personally, I can never exhaust in counting my blessings and self-development that I've obtained. Through the recommendation of my head of department, Dr. Boateng, I've been able to help patients who are registered under the Thyroid Ghana Foundation, even auxiliary patients who come in as walk-ins. And from the energy and the enthusiasm that the President's Foundation always carry, keeps us going as part of volunteering for this foundation. And of course, if you want to go down the memory lane and then speak about the few opportunities that most of us have had as part of volunteers of Thyroid Ghana Foundation, I'm sure time will not permit us. And as they say, memories have the sad parts and then the good parts. But believe you me, there is no sad part of this foundation.
Thyroid diseases are quite common in our country. Most of them are caused by deficiency of iodine in the diets. With the inception of the iodination of salts, these conditions have gone down a bit, but we still see quite a lot of patients who come with varied sizes of the thyroid gland. Some of them, the function of the gland is normal. For others, the function is raised, so they will have to be put on medication, do a lot of investigations.
I knew of goiters, the enlargement of the thyroid gland, which most of us know, but there are a lot of other types of thyroid conditions that a lot of patients are living with, which they don't even know they have. And this gave birth to the foundation. And I also believe that probably my mother died out of it because she was never diagnosed. And she had most of the symptoms that I had before I was diagnosed and managed with my condition. And this was one of the many numerous reasons that inspired me to start a foundation, so that we'll be able to put a lot of awareness out there. Because if I was working in a hospital for that long and I didn't know about thyroid disorders or diseases, then how about the average person out there who doesn't work in a hospital or who had not had the privilege to be working in the health sector? How would that person know? So these things were all part of the reasons why the birth of Thyroid Ghana Foundation came to being in 2018. After I had my surgery, it was one of the promises that I made to God that if I go through my surgery successfully, I'll start a foundation to create awareness first and foremost, and also to support patients who need this kind of support.
Most of our patients face a lot of challenges, and some of these, or paramount among these, is the financial constraint. They are not able to afford some of the basic labs that helps us to prepare them for the surgery. Some of them are unable to afford the admission to the ward, and this creates a lot of problems for the patient and the healthcare managing as well.
The stigmatization alone that somebody will go through, even with those who have the enlarged thyroid gland, which we call goiters, or in Akan language we call the compo. Growing up, we were told of a lot of myths about people living with goiters. That is this, they are witches, they are that, and these are some of how such people are treated in society.
These medications and investigations are quite expensive, and so a lot of these patients need help for some time because they are not able to come by money to come to hospital. They stay a long time in their homes, in their communities, and these thyroids develop into very huge lumps, making operations difficult.
So as part of the limitations that we encountered during our 5-year span as part of the Thyroid Ghana Foundation was with regards to making patients understand, making patients have the courage to seek efficient medical care with regards to thyroid disorders. And then as part of that, we had the opportunity to engage with media, which we can't mention. That those media platforms gave us the opportunity to throw more light on the condition and how it is diagnosed, and then the access to care, and of course care that is efficient. So the second limitation has to do with when we had the opportunity to do media outreaches. We went to churches, we went to schools, we went to homes, we even had door-to-door visitations, and then we chanced on other patients who were misdiagnosed based on the presentations or the symptoms they reported to the hospital with. So we had to do follow-up visits and then make them seek the right and efficient care for the type of thyroid disorder that they have been diagnosed. Some happen to be living outside cities where dietitians are not available for the consult. So we had to arrange for them to come to cities to see dietitians to continue their care.
The problem is most of them are unaware of their conditions, and it creates a lot of problems for them.
At the moment, it is very difficult to find information that is specific for Ghana when it comes to thyroid disease. For instance, why is it that some places in Ghana have more thyroid disease? Why is it that some ethnic groups in Ghana have more thyroid disease? We don't know whether there are genetic factors or whether there are social factors or whether there are environmental factors that lead to thyroid diseases in Ghana. These are all things that need to be researched seriously so that we can have necessary remedies.
The symptoms of a thyroid condition look so much like a lot of conditions, making diagnosing a thyroid disorder very difficult. I put my own case as an example, where it took almost 8 months before I was diagnosed I had a thyroid disorder. This is one of the reasons why that after I was diagnosed, well managed, and after I had my surgery, I decided to start a foundation. Thyroid Ghana Foundation so far had collaborated with a lot of institutions, laboratory institutions, hospitals, media houses, and through this we've been able to reach out to patients who come to us, and we're able to guide them as to how they should live their lives. We've so far collaborated with MDS Lancet, who gives our patient 20% discount on all the labs that they do to them. MDS Lancet, we say God bless you for bringing us this far since 2018 that we launched this foundation. One of our biggest collaboration has also been with the University of Ghana Medical Center. I say that having worked at UGMC has been a blessing, both to myself and also to my patient, the thyroid patient as well. Since 2021, that Thyroid Ghana Foundation wrote a letter during the World Thyroid Day that we wanted to collaborate with UGMC. As a result of COVID, a lot of thyroid cases, patients who needed thyroid surgeries were cancelled. It kept being pushed left and right, and they reached out to us. We wrote a letter, and management of UGMC, under the leadership of Dr. Darius Kofi, CEO, God bless you. We are so grateful for accepting to collaborate with us, for us to do subsidized thyroid surgeries for patients who needed these surgeries, as well as to also care for thyroid patients who needed total thyroid care at a subsidized rate. We thank you so much. We can't be grateful enough. We also thank Dr. Solomon Brookman, the head of UGMC Surgical Department. Dr. Brookman, God bless you. May he continue to anoint your hands so that every life that you touch will live long. May God bless you and bless your generation. We are so grateful. We thank all UGMC staff, the anesthesia team, Dr. Foswapia, you and your team. We are also grateful for everything that you've done since we started the collaboration in 2021 to date.
So we are excited about the collaboration between Thyroid Ghana Foundation and the University of Ghana Medical Center, UGMC, regarding the collaboration that we have in the treatment of patients with thyroid diseases, particularly those who have goiters. the Thyroid Ghana Foundation wrote to the UGMC so that we could collaborate in the treatment of these patients, primarily because most of these patients could not afford the cost of surgeries. And so what we have done is to subsidize the cost of these surgeries for these patients as a hospital. And this we have done because of our commitment to quality patient care, as well as a form of corporate social responsibility. And I'm happy to say that since the inception of the program about 2 years ago, we've been able to operate on about 27 patients, and all these patients have been cured of their conditions, such that these operations have all been successful. So if I should say, we've had about 100% success rate, and this has really brought a lot of relief to these patients and their families, having done these surgeries at a subsidized cost. This is because most people are walking around. I'm sure we all know people who walk around with large neck swellings or goiters, but they've not been able to have operations because of cost implications, and sometimes also because of psychosocial beliefs. And I believe that the Thyroid Ghana Foundation is doing a lot of work, and their work needs to really be supported, because they are not only subsidizing these surgeries, but they are raising an awareness about thyroid diseases, and also to let people know that these surgeries are safe and it is not dangerous, and that if you have these goiters, please go to hospital, talk to the hospital people, talk to the surgeons, the doctors, and you receive the necessary assistance that you need.
The Thyroid Ghana Foundation was commissioned in 2018, and in 2021-22, as part of the awareness creation of the Thyroid International, they approached UGMC for us to assist in alleviating the plight of these patients. The whole concept was to help the poor and the needy who otherwise would not have the opportunity to be diagnosed and then treated. Through the foundation, we were able to offer care for 25 patients, and I'm told that this year we've added 2 more. The whole care is, first of all, to diagnose such people and then to take them through the care journey, where those who required surgeries were offered. The offer here was that they were paying just about 50% of the total cost, and this was the support that UGMC could offer to the foundation. Apart from the surgeries, I'm sure most of them were educated about how to take care of themselves and how to the signs and symptoms that comes with these conditions and how to live their lives. It is not all the cases that require surgical intervention. So for those who needed medical care were also cared for. So in the whole, I think the collaboration has been very fruitful. We will continue offering the collaboration. I'm not sure about the statistics, but I'm sure that quite a number of people are working with this condition. And I think through this collaboration, we have created some awareness through social media interventions, YouTube and others. And we are getting a lot of people coming to find their status so far as this condition is concerned. Of course, we are also using this platform to let people know that UGMC is not only for the rich or those who can afford it, but we want to open our doors so that equity and diversity will be part of our vision. So everyone who has this condition can walk in, and then we can offer the care path for this condition. I'm sure most people are having a lot of conditions that they may not be aware of what is going on with their lives. And through laboratory investigations, some of these conditions can be diagnosed. Those who require medical treatment will be offered. And those who require medical surgical interventions also, we will assist them to get these interventions. So far, I think through this collaboration, we've succeeded having 27 people operated. And they all went through successfully. There hadn't been any complications so far. And we will urge everyone to, who for some reason is scared of getting this treatment, our doors are open for you to come and then get this help. We want to thank the foundation very well. They are doing very well. And we will urge that the collaboration goes on between UGMC and then the Thyroid Ghana Foundation.
With the help of the Thyroid Ghana Foundation, and at this point, I would like to really thank the University of Ghana Medical Center, who have accepted us and collaborating with us. They're able to reduce the cost of this, of the care of these patients to as much as just a third of the total cost. So a lot of patients are now able to afford, and they come early for their conditions to be diagnosed, and then they get the necessary treatment.
2017, and I'm in thyroid. Nani da swasa. Yare ni chimi mami phone ye kiti. Timi beti Thyroid Ghana Foundation inka. And I'm Johnny Betua. Me buy ever share Mrs. Johnny or Jimmy or Buami or introduce me to doctors or UGMC. I even got to know, say, thyroid no, our mahuro, any near winya, any near maybe war, and say, ubedi if you are thyroid patients. Say, we are thyroid patients, not say, who nimu a jania ubedi, ubeti me din jane binuma, it still triggers the sickness. But me ba or mohono, omo introduce me to dietitians, doctors, ahudro, omo buame. Emma me who say a journey be wa. We are thyroid patients as I say obedi. A bisu wa as I say would 5 years down the lane. Mina me my bag me dad demogra as a brusso.
You didn't come with that Thyroid Ghana Foundation for us say Pamucho me who a Ghana Thyroid Foundation social media YouTube and me de me who be joining home. Me friend the founder no and any didn't come up because me tsunami was thyroid inti me ka say me pese me be hunu na me so me de me ho be join omo na omo timi ya me thyroid ne mami me friend no so no oje me so fel e ma me baye o me baye no omo je me fel so na omo ye bibia and now my thyroid and every or am of and see the American and saying I could push round pa. No, no more kesse. Now, for floss so almost so abundant so and communia young combe baby your more thyroid. Nancy Casemunti, Omunti member. Omumbra no moba ombejemu felso me buy your cradea omu sifaya me omune me kasa omu treat me nice until be biara or thyroid problem ombra no say na oba omobeya manamon so enya na hoto
achome damu ase ohwe spa ho de hwe me sister ahawa okom no na eso but one boy no one yin yare na afiri ho ama me akora ma ni agi abroso me damu nyina se yankopon hira mo ni me dam na madana na adwo ase se wa hwe yeso ye ba ye no the way on your casa and Coraponama, Yalenocra, Alcoform, Amaye.
If I say when so other Dr. Brook, my say Dr. Eduardo, Yamishla Omopa, Yamishla, because Mamma may say, Master Yam kissing. Uncle Swana Munyed, my palm of Fatomus. Yes, Rabua for Susamumba and Bobo Thyroid Ghana Foundation. Said the baby to me, a Cornell, Yamishla Ubipia.
Thyroid Ghana Foundation is 5 years old, and we are pleased with the work that they've done, especially on our wards. Most of our patients have smiles on their face post-thyroidectomies.
As a DDNS of UGMC, I'm happy to be part of the Thyroid Ghana Foundation's 5th year anniversary.
As part of our 5 years anniversary celebration, we plead and we count on, or we call on, organizations, churches, even schools, and then corporate associations or bodies to help with the sponsorship of most of the newly diagnosed thyroid patients, and then even those who are not even diagnosed and they are walking around with presentations of thyroid disorders, to come on board and then help our patients to seek efficient, timely, and then tailored health care for patients who are having thyroid disorders.
Even if you require thyroid surgery and you don't have the money to do it, you will still be buying medication, which is also still expensive. So that's why we're celebrating our 5th year. We are calling on the good people of Ghana to please come to the aid of the patient who want to be part of this subsidized project, however, unable to raise less than they have the amount that they had to pay, so that we'll be able to support them, for them also to put smiles on their face and their families. Because when we are sick, we are all in our vulnerable moment. That is when this question comes to our mind: am I going to die? So that thought will also not be part of their lives, because you keep thinking about that every day of your life, and that alone is not a healthy living. So please, everyone should come and support us so that we'll be able to help these patients, for them also to take their lives back and live a happy lives with their families. If you're a pharmaceutical company that produces any of the medication that Thyroid Ghana or thyroid patients are taking, you can donate them to Thyroid Ghana Foundation and we'll get the patient to take them. If you're a church, you want us to come and do education, please let us know. We'll come and do the education. Then you will let your church make a donation to us so that we'll be able to support these patients. Every donation that comes to the foundation is put to good use. It's put to put a smile on the face of a patient. It does not come to the pocket of anybody or any individual.
I'm going to encourage researchers, doctors, nurses, pharmacists, and all of us, and also the government, to put some money into thyroid research, because thyroid and other autoimmune diseases are quite common in Ghana. Most of the time they don't get diagnosed. So it is very important for us to do active research in this area so that we will be able to diagnose these diseases and treat them, because these are diseases that are treatable, which if we diagnose it early, it will not be too difficult to treat.
As the proverbial Oliver Twist, we would like to have more and be able to help as many of these patients as we can. Up till now, we've been able to do about 27 operations which have been successful. So with this collaboration, we've actually had 100% success. So we want to encourage more corporations, other bodies who can support this noble endeavor, so that we'll be able to treat more patients and help them, bring them out of their suffering. It's quite expensive, as I said, but as time goes on, we hope to be able to get more support and treat more of these patients.
We would like to encourage the public, individuals, organizations who are willing to help us to be able to sponsor these patients to have the thyroidectomies done. It will go a long way to put smiles on their faces and help them to have a better life.
I would like to plead on corporate bodies and the general public as well as pharmaceutical companies to support in cash or kind to enable us help people living with thyroid disorders.
Afesuso mefa konya we so aslabu afose mo be Thyroid Foundation mo be so masne na omutimi muaye nso so ayeti say yamwa say bi.
Say God bless Mr. Kwame of Hill Pharmacy, the CEO of Hill Pharmacy, for always coming to our aid for donating thyroid medications for us to give to our thyroid patients. Hill Pharmacy, see you. God bless you so much. And we ask that as Oliver Trace, we ask for more. Please continue with us since the journey has not ended. We would like to thank all doctors, all endocrinologists, all surgeons, all ENT specialists, all anesthetics who have been in support of this project that we are doing, for taking care of our patient. Anytime that we call you, for helping us to take care of our patient. We also want to thank all pharmacists who also come and explain the side effect and other consequences when it comes to the taking of the medication. Our biggest thanks also go to our dietitian one, Frank Ayimadu. Frank, God bless you so much. Since 2018 that we started this journey with you, you consult to the patient free of charge. We pray to God that whatever that is laid on your heart will come to pass. We thank each and everyone who is yet to support the Thyroid Ghana Foundation. We want to thank you ahead of time, and we want to ask God to bless you ahead of time so that you'll be blessed to be able to support the Thyroid Ghana Foundation. I'd like to also thank few friends that have been tasking when it comes to the activities of the foundation when it's beyond me. All friends of Thyroid Ghana Foundation, as you prefer to be called, God bless you all for seeing to the activities and for supporting Thyroid Ghana Foundation and our patients, and always coming to the aid of these patients when we call on you. We'd like to thank each and everyone. We'd like to thank all volunteers of Thyroid Ghana Foundation. May God grant your heart desires. We thank you, everyone. We thank our media crew also for coming to the aid of the foundation and for supporting this work that we are doing. We know that as we long ahead, that the biggest dream is to have a Thyroid Ghana Foundation hospital to be able to give free care to these patients who are not able to afford. This dream will be a reality. So if you are someone out there who has some money who would want to partner with us to see to this reality, please feel free to come to our aid and let's have a discussion. We thank you all, and we hope that come 25th of May, we'll see you all at University of Ghana Medical Center Auditorium as we celebrate the 5th anniversary, and we also host the president of Thyroid International Federation from Canada in Ghana here. We hope to see you all as we celebrate this anniversary with a lot of the media houses, all media houses who had also decided to come to our aid and partner with us. We are grateful. We want to thank Daily Guide for coming to our aid. We want to thank Metro TV. We want to thank Breeze FM, ISO Media. I want to thank you for all these videos that you've been doing for us. Without you, people will not know what we are doing out there. So ISO, thank you so much. And we ask each and everyone out there that if you have any program and you need a good media house to take care of you, reach out to ISO Media and they will take good care of you. Thank you, and we hope to see you on 25th May at UGMC at 10 a.m. as we celebrate the 5th anniversary of Thyroid Ghana Foundation and Thyroid International Day. Thank you very much.
To Thyroid Ghana Foundation for the very good work they are doing in bringing smiles to the faces of the patients and families who have thyroid diseases. And we pray that they will live long to bring more smiles to their patients and their families, and to bring a lot of relief to people, and to let people know that thyroid diseases are just diseases like any others and not something mystical, if I should say.
On the 5th anniversary of the Thyroid Ghana Foundation, I'd like to congratulate Nana Adjoa, the board, for the great job that they've done so far.
Thyroid Ghana Foundation edi omo 5 years a. When I me kan kire omo se nyame won hira omo. Me mo ayiko sika biara omo ahwere e wo me eni wo bi biara adwanet organization omo agye no no. Erade hye omo anan ayiko nyame hira omo.
Coincidentally, the Thyroid Ghana Foundation will be 5 years this July, and UGMC also will be 5 years. So I'm sure we've all grown together, and there's a lot to talk about, and there's a lot to share in terms of what we've all been able to achieve in terms of healthcare. I want to use this opportunity to congratulate the foundation for this good work. We hope that the foundation will grow to do more to help alleviate the plight of the needy. UGMC also, I want to use this opportunity to congratulate all staff and members who have been part of this journey, and especially to Dr. Brookman, who is the main surgeon who has helped this foundation to operate most of these clients. We hope that this collaboration will grow, and in the next 10 years we should be able to talk about how this foundation have gone beyond the borders of Ghana and beyond. Thank you.
So Thyroid Ghana Foundation is 5 years old. I would like to send a congratulatory message to them. I know the journey has not been smooth or has not been easy so far, and we pray that everything that they are doing is going to be bigger and better in future, so that they be able to help the public.
I also like to congratulate the Thyroid Ghana Foundation as well as UGMC on the impact they've made on such patients.